In 2005, I discovered a lump, and I immediately was frightened because my mom is a cancer survivor. As far as we know in our family, she's the first person that had breast cancer. I would be the second. I had a mastectomy to treat the first cancer. In 2005, mastectomy with chemotherapy and lymph node removal. And my second cancer was in 2007, unfortunately. That cancer was found through mammogram. My question with the cancer was, is this it? This is it? This is how I'm going out? You know, I was married, I don't know, I got married in 98, what is that, 6 or 7 years. We were just beginning our life. We bought a house. Just in general becoming comfortable with who I am, what I like, what I don't like, what looks good, what doesn't look good. So I just didn't want to leave. I think as human beings we all have that fear of death because we just don't know. It is family members, close family members, that said I should come to Sylvester and ask for this doctor and look into the, and you can't get this doctor, I have another one. And so it's really through family that I'm here and that I have the doctors that I have. Anyone who's newly diagnosed with cancer can feel confident in coming to Sylvester. It is a research facility, which is important. So every day there are new things being discovered, new things being worked out. Some of the best ideas were formed here. Some of the best ideas in treating cancer were formed here, were, you know, originated here by some of the surgeons who are and doctors who are still working here. It's a wonderful place with very comforting people, all the way from the people that greet you when you come for your appointment to the nurses. If I was sitting in the chemo area of the hospital of Sylvester, and maybe it was a horrible day, I'd have to think about, well, you know, in 3 weeks, I've planned a trip to Jamaica, which really happened. And I'm going to hate everything I'm going to eat for the next 3 weeks. But in the third week, the taste buds are back and it's on. But don't get me wrong, I wasn't the model patient. There was one point where I was just doom and gloom and despair. I had a really bad chemo episode. It was in the beginning of chemo, and you know, everything is a balance, finding out. I became really sick. I became toxic, they called it. And I was stuck in the hospital, and I just hated every minute. I was mean, and I would yell at them, and I'm not getting up to, I wouldn't get up to do anything. I wouldn't, it was just horrible. But I think that it showed that I was human. I mean, if I went through this whole thing and it was just, this shouldn't be a good experience. It's not a good, it shouldn't be something you want to relive, you know? So I had my moment, but the important thing is that you can't dwell in those moments. If I had stayed in that, that would have been very dangerous. I think it's important for people in this situation to surround themselves with people who are thinking life and believing life and fighting with you. I'm 2 years cancer-free since my last cancer was in 2007. August of 2010 will be my 3rd year. I'm working hard toward getting to that 5th year that everyone dreams of. Fifth year and beyond, I say. And I know that there's a team behind me working on that too. So here I am with my chemo chic due, and happy to be alive, and glad that I had the right care to find everything.